Welcome to Dr. Baliga's podcast for the curious doc. Today is May 30th, 2026. This video is in a review article in The Lancet on Alzheimer's disease. What is Alzheimer's disease? The leading cause of dementia and a major cause of mortality and disability in older adults. Why is it important now? Advances in biomarkers, imaging, genetics, and therapy are transforming care. What are its hallmark lesions? Amyloid beta plaques and tau neurofibrillary tangles. Is Alzheimer's disease reversible? It is progressive and currently not reversible, though progression can be slowed. What is the major goal of research? To prevent disease onset and arrest progression. How common is dementia worldwide? About 57.4 million people lived with dementia in 2019, with projections rising substantially by 2050. What proportion is due to Alzheimer's disease? Approximately 60 to 70% of dementia cases. Who is most affected? Older adults, with higher prevalence in women. What causes autosomal dominant Alzheimer's disease? Mutations in genes APP, PSEN1 and PSEN2 genes. What is the strongest genetic risk factor? APOE epsilon 4 increases risk and lowers the age of onset. Modifiable risk factors. How much dementia risk is modifiable? Approximately 45% may be linked to modifiable factors. What vascular risks matter most? High blood pressure, diabetes, obesity, hypercholesterolemia, and smoking. Does education matter? Higher educational attainment may build cognitive reserve. Can lifestyle offset genetic risk? Healthy behaviors can reduce risk even in genetically susceptible individuals. Why are gene-environment interactions important? They influence disease risk and may guide personalized prevention. What is the typical presentation? An amnestic syndrome with difficulty learning and retaining new information. What is posterior cortical atrophy? An atypical variant presenting with visuospatial and visual processing deficits. What is logopenic primary progressive aphasia? A language predominant form with impaired word retrieval and sentence repetition. What is mild cognitive impairment? Objective cognitive decline with preserved functional independence. What symptoms appear later? Neuropsychiatric symptoms, seizures, myoclonus, and Parkinsonism may emerge. What are amyloid plaques? Extracellular amyloid beta aggregates that accumulate in characteristic patterns. What are neurofibrillary tangles? Intracellular aggregates of hyperphosphorylated tau protein. Which pathology best correlates with cognition? The tau tangle burden and distribution. Are co-pathologies common? Yes, vascular disease, Lewy bodies, TDP43 pathology, and cerebral amyloid angiopathy frequently coexist. What are resistance and resilience? Resistance avoids pathology. Resilience preserves cognition despite pathology. Brain imaging biomarkers. Why is MRI used first? To exclude structural causes and assess atrophy and vascular disease. What does FDG PET measure? Regional cerebral glucose metabolism, reflecting neuronal activity. What does amyloid PET show? In vivo amyloid plaque burden. What does tau PET show? Distribution and severity of tau pathology. Why are imaging biomarkers important? They improve diagnosis, staging, prognosis, and treatment monitoring. Fluid biomarkers. What is the classic CSF signature? Low A beta 42 and A beta 40 ratio with elevated total tau and phosphorylated tau. Which plasma biomarker performs best? Plasma p-tau 217 shows excellent diagnostic accuracy. What does neurofilament light chain indicate? Neuronal and axonal injury. What does GFAP reflect? Astroglial reactivity. Why are blood biomarkers valuable? They are less invasive, scalable, and suitable for screening. Diagnosis and future directions. Can Alzheimer's disease be detected before symptoms? Yes. Biomarkers can identify pathology years before clinical dementia. What is the A by TN framework? It's a biomarker framework based on amyloid, tau, and neurodegeneration. Why is early diagnosis important? It enables timely counseling, monitoring, and treatment consideration. What are the major unmet needs? Better co-pathology biomarkers, earlier detection, and personalized therapies. What is the long-term vision? Prevention of disease and durable slowing of progression. This is a fantastic review in Lancet. Go ahead and read it. This is an infographic on this article. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.